Well, good morning, ladies and gentlemen. This is the Truckers Podcast. I'm your host, Doug from Ontario, Canada, and welcome to the show. This is December the 19th, 2021. New restrictions for Ontario, Canada, with this Omicron variant starting to take hold here across Ontario and Canada, and of course, right across North America. Thank you for coming out this morning. Thank you for joining me this morning, ladies and gentlemen. Well, I decided to wait a little bit longer to come out here because throughout the week, so much was been happening on whether or not the Ontario government was going to make changes to any rules out there or any changes to restrictions, and to wait for these announcements to come up and what's going to be said. I could come out here and say, oh, we're going to make some changes to the restrictions, but we don't know what they're going to be yet, and like that. So holding off and to make sure that the announcements come through and what the changes are going to be. Now, what has happened here, and right now, here right across Ontario, the largest province here in Canada, we're seeing over 3,300 new cases a day here in Ontario. Now, Doug Ford, the Premier of Ontario, is taking this approach, because the last time, we were seeing these sort of cases, I think it was something like April, of this year. And, this is, we would go back into lockdown, stay at home orders, close non-essential businesses. During his announcement, he said that's not the answer. Going into lockdown, stay at home orders, closing non-essential businesses like that. He says that, that's not the answer. That's not what we're going to do. But nothing is off the table. The projection from the science table here in Ontario is that by mid-January, we could start seeing over 26,000 cases a day. So what Ontario government in the science table had come up with is to, slashing gathering sizes, reducing indoor capacity limits as this COVID-19 cases start to soar here in Ontario, Canada. So now they have announced the new restrictions, including cutting gathering sizes and slashing capacity limits to 50% for most indoor settings as COVID-19 cases soar in this province. So starting at 12:01 a.m. on Sunday, meaning today, these new restrictions take hold. And the sizes will drop from 25 people to 10 people indoors. And outdoor gathering limits will be lowered to 25. Ontario is reintroducing capacity limits of 50% at most indoor settings across the province. This includes places like restaurants and bars, personal care services, retailers, and even including the shopping malls. And this is even including the big box stores because they're not privileged. 50% capacity, period. So if you were doing any shopping today, and look, ladies and gentlemen, Christmas Eve is this Friday. Next Saturday is Christmas Eve or Christmas Day. You should be done your Christmas shopping by now. But that's never the case because there's always those last minute shoppers out there and there's plenty of them. But this year, I decided that I am getting my Christmas shopping done early. Thank you for joining me this morning. I'm your host, Doug, from Ontario, Canada. Now, just before you come on the show here, I'm talking about the new restrictions that the Ontario government is putting in place due to the rise of COVID-19 with this Omicron variant. Now, earlier in the week when the Ontario government was mulling around with what kind of restrictions they were going to come up with, the last time that we saw 3,300 cases a day was back in the early spring. And, we're in lockdown, stay-at-home orders, closed non-essential businesses. Premier Doug Ford, he said, that is not the answer. We're not going to shut down. We're not going to go stay-home orders and close non-essential business. But nothing is off the table. Now, the health advisory panel, the projection, what they're talking about, by mid-January, we could see 20,000 to 26,000 cases per day if we don't take action now. And by reducing capacity limits and ramping up on the booster shots, will this be enough to avert any other measures? Now, cutting the capacity limits to 50% for most indoor settings, and this also that doesn't just include the shopping malls, the restaurants, the bars, personal care services. This includes all sporting events to 50% capacity. Now, what it includes in the sporting events and movie theaters, effective today. This is when these measures come into effect. So even movie theaters, the sporting events like hockey, which is the National Hockey League, and even here on the Ontario Hockey League, to 50% capacity, and no food or drinks will be served starting today in those establishments. So the big sporting events, movie theaters. Now, I've heard from people, before, before these changes came into effect, having full capacity in the arenas for hockey, not a lot of people, but enough that they think it's okay just because you have a drink in your hand and the popcorn sitting on the floor, you can have your mask down. That's not, that was not the rule. You have to be drinking it and you have to be eating it in order to have your mask now, not just holding it in your hand. So, regardless of that, like I said, effective starting today in in the arenas and in movie theaters, that no food or drink will be served. You have to have your mask on all the time. Anybody in the restaurant, because it'll be now cut back to 50%, we're still allowed to have about 10 people per table. Now if your restaurant held 500 people, well, you can have 250 people in your restaurant. Now most restaurants don't hold 500 people, but that's just an example, of 50%. You'd have to be remain to be seated, unless of course you have to use the restroom, which then you would have to put your mask on and proceed to go do your business and return back to the table. And then that's when you can remove your mask again. And that's always been the case. Now, the other thing that's going on here with the bars and the restaurants, whether it is the strip clubs, so additionally, the bars, restaurants, strip clubs will be ordered to close at 11 p.m., with the exception of takeout and delivery services. Now, like I said, the number of people permitted to sit at a table will be restricted to 10 people, and patrons will be required to remain seated in the restaurants, bars, and other food and drink establishments. And that even includes your Wendy's, your McDonald's, whatever the case may be, any food or drink establishment. Now, when you go to a bar, I mean, usually, it's a dance club or whatever the case may be, dancing will not be allowed, right? Unless you're going to a strip bar where the only ones who will be accepted to dance would be the workers or the performers or whatever the case may be. There'll be no lap dance, gentlemen. That's not even going to be allowed. Now, this, I guess it's better than the government, turning around and, going back and, saying, okay, we're going to go back into lockdown. We're going to close non-essential businesses. All the schools, including universities and colleges, they are now on their Christmas break. And for the high school as well, and in the public schools, Catholic schools, the government has said, be prepared that the Christmas holiday for the kids could be extended. And that means coming into January that they're talking 2 weeks. So it could be the middle of January. It could potentially be the end of January before kids get back into class, and that is all going to depend on these cases. Now, every single child in elementary school was sent home with the rapid testing kit and with instructions on when to use it. Every single kid in this province of Ontario was sent home with rapid testing kits. And then the Ontario government made the rapid testing kits accessible to everybody. And on the first day, they ran out. So hopefully they get more rapid testing kits. So anybody who wants to get a kit, hopefully they'll get restocked. Everybody will be able to get a rapid testing kit for your own use in your own home. Now, the full list here, starting today, like I said, for the reduced capacity limits, like I said, the Ontario government is introducing a 50% capacity limit in the following indoor public settings, and this is going to be all of them. So the restaurants, bars, and other food and drink establishments, personal care services, personal physical fitness trainers, retailers, including grocery stores and pharmacies, shopping malls, non-spectator area of facility used for sports and recreational fitness activities, gyms, indoor recreational amenities, indoor clubhouses and outdoor recreational amenities, tour and guide services. These limits do not apply to any portion of a business or place that is being used for a wedding or a funeral or religious service, rite, or ceremony. Now, the rules for some non-essential services, this is all effective today. In food establishments and event spaces, the number of people permitted to sit at a table will be limited to 10 people, and patrons must be required to remain seated. Unless, of course, you have to use the restroom. Bars and restaurants, meeting event spaces, strip clubs, like I said, will be required to close at 11 p.m. So that means at 10 p.m., they stop serving alcohol. Food and or drink services will be prohibited at sporting events, concert venues, theaters, and cinemas, casinos, bingo halls, and other gaming establishments. The sale of alcohol will be restricted after 10 p.m. and consumption of alcohol in businesses or settings after 11 p.m. Now, as it stood just like yesterday, before all this came into effect today, you could have, 25 people in your house. Could have whatever amount of people in your backyard. Didn't matter. Now it is down to 10 people in your household and 25 people outdoors. Those are the changes. Now, I've said this, a while back on one of my shows. When the Ontario government is counting case counts. How many case counts do we have? Well, right now we're seeing over 3,300 a day. What in my mind, and what I'm thinking is that it should come down to hospitalization and ICU. When those numbers start to increase to where it starts to affect the healthcare system, that's where it matters. And then that would decide whether or not the Ontario government would say, okay, you know what? We have to go back into lockdown, stay at home order. But we don't want to see that. We really don't. Now, according to the physicians out there here across Ontario, the disease and infection doctors, what is driving our cases? Who is in the driving seat, in the driver's seat? Unvaccinated. And you know that, these vaccines, they're not 100%. And I've said this before. Just like the flu shot is not 100%. I mean, if the Pfizer sitting at 95%, you still can get COVID. This Omicron variant is more transmittable than the Delta variant. And it's spreading like wildfire around the world. Take a look at the United Kingdom, the Netherlands. Take a look at the United States. Now, considering the population of the United States and, roughly, you're probably around, 60%, vaccinated. I mean, that's, it's a lot of people in the United States. Almost 400 million people in the United States alone. Here in Canada, we have a population, approximately, 37 million people. And we're only sitting at like 76% fully vaccinated. And that's just unacceptable for this population. We should be easily fully vaccinated, and including the 11 to 18-year-olds. Now the government here in Ontario is now the booster of this vaccine. And, as of, like back in the start of the week, anybody, 50 and older can book their booster. Now they have changed that and said anybody 18 and up now can book their booster starting tomorrow. But our cases are already starting to soar. And anybody who is 18 and up starting tomorrow can book their booster is going to put them far out into January. Even myself, I'm in my late 50s. And it took me a little while to get a date for my booster for the 50 and up. And I finally got one for December the 24th. and it was filling up fast. So that day is already completely booked. And anybody who didn't get it booked, so, December will be pretty much full for the booster. So that means those 18 and up are going to be looking at January. We're pushing this far out. Who's eligible for a booster. Now, there is a question mulling around, about the booster. Potentially, could this mean and make a change of saying the booster now means that you're fully vaccinated? They're mulling around with this. So I don't think that is necessary to say that it's going to take the booster to be fully vaccinated. Because as it stands right now, when it comes to sporting events, when it comes to restaurants, when it comes to bars, you have to be fully vaccinated, and you have to have the proof that you're fully vaccinated in order to go to a sporting event, to dine in a restaurant, to go to the gym, to go to the movie theaters. Now, everybody, because, this new Spider-Man movie came out, right? No Way Home. So everybody knew today would be that the movie theaters will be now down to 50%. So a lot of people went to the movies yesterday, because it was going to be the last day for a while, because it's going to be 50%. And it's going to be a while because you're not going to be able to have any popcorn or any drinks while you're in the movie theater to watch a movie. Now, the federal government of Canada, has always had this advisory, the travel advisory. We've always had this in place. Whether it was the Delta variant or all the other variants that has passed through, and now this Omicron variant, we've always had this travel advisory. The government is asking you not to fly international. Now, here in Canada, if you want to fly domestic, visit relatives, if you have relatives on either side of the country, you have to be fully vaccinated. So you have to be fully vaccinated to get on a plane, a train, whatever, to travel across this country. You have to be fully vaccinated. So domestically, if you want to travel, you travel, but we're talking about international travel. With the surge of the Omicron variant around the world. Because if you travel internationally and you get stranded because maybe that country decided that they're going to shut down their airspace, there's little to nothing the Canadian government can do to help you. Now, back in, I guess it was November, when the United States opened up their land border to Canada and Mexico. The Canadians that travel south for the winter, whether they go to Florida, Arizona, California, you know, you still, you know, you got to take precautions. Now, Canada, has also, for international travel, so for anybody who wants to come to Canada, um, there's restrictions. And you have to be tested in the country that you're leaving from. And of course, you have to test negative. Now, in order to come to Canada, you have to go on the Canadian Arrival app and you have to fill out all your information. And you have to have legitimate proof of vaccinations. And you have to have a plan, just in case you test positive. You have to be tested again once you arrive at the airports here in Canada. And this is going to be all at your own expense. And that goes for Canadians who are planning to travel abroad or who are coming back. We too have to fill out that Arrival Canada app. All that information. Now, for the land border travel, because when the United States opened up the land border, when they first initially opened up, Canadians, even if you went just to go across the border just to do a day trip and do shopping, you still had to fill out that Canada Arrival app and all your information in order to return back across the border. And everybody was up in arms about it. I'm going over there just for the day. I'm going to do some shopping and I have some lunch. Maybe I have some friends there. I'm not going to be, 72 hours. I'm going to be 5 or 6 hours. So the government said, okay, you had to take the PCR test as well. So while you're over there for the day, you had to go find a place to take the PCR test, whether it was $100 or $150, and have that done to come back across the border. That was absolutely ridiculous. It was fully vaccinated people, right? So then the government changed it. So anybody less than 72 hours, you didn't have to do that PCR test, but you still had to fill out the Arrive Canada information, even though it's just a day trip, up to 72 hours. Now, starting tomorrow, we're going back to testing again. So that means if you just drive across the border into the United States just to do a day trip, you're going to have to do a PCR test again to come back into Canada because of this Omicron variant. Regardless if it's 72 hours or not. Now, because we're approaching the holiday, Christmas. Christmas Eve is next Friday. People want to, have family around the world, and people want to travel to see them. I get that. I understand that. But you really, ladies and gentlemen, really have to think long and hard about this. I mean, is it worth the risk? If in fact that you get stranded and that you can't return. Because the government, there'll be nothing the government can do. It's not like the onset of this pandemic, back in 2020 of March, when the government tells every Canadian abroad to come home, and then people got stranded, and then the government worked out ways of getting people out of those countries, by sending our, Air Canada and everybody out there. So empty planes to these countries to pick up Canadians and bring them back home. That was the onset of this pandemic. But now the government is not going to do that. So if you travel abroad and you get stranded, that's your problem. If you come down with COVID-19 while you're abroad, that's your problem. That's the risk you're willing to take. Some people say, oh, I wouldn't mind if it was Cuba. Good afternoon to you. And it is morning here in Ontario, Canada. It is 9:09 a.m. here where I am. So, okay, sorry. That's okay. Now, here, we think about, people who are getting infected. It's going. I mean, it's going into athletes as well. The Toronto Maple Leafs, Calgary Flames, Colorado Avalanche, Carolina Hurricanes. It is starting to affect the sporting world. Healthy or not, vaccinated or not. I mean, you have, 7 to 10 times more chances of catching COVID if you're unvaccinated. And the complications could potentially be far worse, including up to death. Vaccines are to help lessen the illness. It's like the flu shot is to help to lessen the effects of the flu. Nobody wants to have those stay-at-home orders and lockdowns and things like that. And if you look around the world, and when countries do this, and their government does this, because, they've done it so many times. I mean, here in Canada, we've gone through 3 lockdown orders. Here in the province of Ontario, where I reside. right? We don't want to see that again. But if you notice around the world when this is happening in other countries and stuff like that, and it happens here too, protests. But then the protests grow violent. People start destroying their own cities, burning cars, smashing windows, burning businesses. When has violence solved anything? Never. I get it, people are upset. I understand that. We've been, coming, what is this, 22 months? Coming the new year on January the 1st, we're still going to be in this pandemic. We're still going to be in this pandemic coming 2022. What has to change? Our attitudes have to change. We're going to have to learn to adapt. What else? Common sense has to prevail. I've said this before. We're all in this together. And we need to help ourselves. Now, people out there about these vaccines, there's people out there who are hesitant. Okay, there's a difference between being hesitant and being an anti-vaxxer. Anti-vaxxers are just no way, no how. Hesitant is just, I'm not sure. I need more information. I got to find out things. But you can't keep being hesitant. Because there are people, professionals, that you can talk to. And I still hear it out there, oh, I'm just hesitant about it. Well, it's time for that change. Anti-vaxxers, you can't do anything about them. They're just simply not going to get vaccinated. That's their problem. But they're making it our problem. You can go into oh, it's against my religion, it's against my human rights, it's against this, against that. Whatever. Even when it comes to restrictions, I think it's the Netherlands going into lockdown again. Ladies and gentlemen, doesn't matter what country you're from. Governments are sworn to protect you. Unless you're, like China or Russia. In the democratic societies around this world. Here in Canada, we have what you call the Federal Emergency Act, which was once called the War Act. Every single province across this country as a Provincial Emergency Measures Act. And in that act, the government can have these restrictions to protect the people. And it says right in there, protection, whether it is war, emergencies such as forest fires, natural disasters, and viruses. The governments have a sworn duty to protect you, whether we like them or not. No, we didn't like it. You know, I'm really not surprised. I'm really not surprised that we're even in a pandemic. In a pandemic, I'm not surprised. We have seen SARS. We have seen MERS, Middle Eastern Respiratory Syndrome, H1N1. It was a matter of time. When things went from an epidemic to a pandemic. It was just a matter of time. Will this be the last one? Probably not. We have to get out of this one first. When will that happen? I have no idea. As a matter of fact, I don't even think the governments or top health officials in this country or any health official around the world or the World Health Organization, they don't have an end date. They're not going to stand up there and say, oh, effective January the 1st, the pandemic is going to be over. There is no end date. We could go into 2023 in this pandemic. So you might as well buckle up and go for the ride. I don't like it any better than you do. I'm fed up. I'm frustrated. I'm human. We're going to have to deal with this. So we're going to have to find better coping mechanisms is what we're going to have to find. We're human beings. We have that ability. We have coping mechanisms, and we're going to have to learn how to use them. You know, with all this social distancing going on, staying apart 6 feet and everything else like that, when you're out shopping and standing in a line and all else like that, you know, on the onset of this pandemic in early 2020, I only had to tell one person to back up. At that time in 2020. This is 2021. And I had to do it again. So that's not bad. Only twice out of this entire pandemic that I had to tell somebody to back up 6 feet. So we are following the rules. But we have coping mechanisms that we can use. Yes, it's still going to be frustrating. But we not only have to look out for our families and our friends. You know, the healthcare workers, the ones who are on the front line from the day one these last 2 years, and it's our doctors and our nurses who has always been there for us to take care of our sorry asses. Whether we're in the hospital of another illness, they're there and they're caring for you. And then when people, you know, these anti-vaxxers, when people decided to protest outside of hospitals here in Canada, impede, harass patients and doctors and nurses, blocking emergency entrances, that really pissed me off. They are not the ones you go protest to. And you don't go to personal homes of doctors to protest in front of their homes. They have an office that you can go and protest in front of them, and you can damn well do it peacefully. And if you can't behave and do it peacefully, then you have no business protesting because you're just out there to cause shit anyways. Things are changing every single day. Every single day. Even though the Ontario government now says only 10 people can gather inside, like your homes. And we're seeing 3,300 cases a day right now. By Christmas Eve, that could be 6,000. And if they see that projection happening by Christmas Eve, the government can step in and tell you that, you know what, now it's just immediate family. And no one else. And knock the outdoor gathering from 25 down to 5. It can happen that fast. And even though ages from 5 to 11 and 11 to 18 and 18 to 120 are getting vaccinated, whether it's the Delta, whether it's the Omicron, these viruses don't take holidays. The virus isn't going to back off because we're leading up to Christmas. It's not going to go on Christmas holidays. It's going to keep moving forward. It's going to keep infecting people. Consider yourself lucky. Consider yourself lucky that you haven't come down with it. I don't know what you do every day. It's not a lottery. It knows no age. It doesn't care. I consider myself lucky. Yes, I do drive a transport truck, but I do not cross the borders anymore, and I haven't done that for years. I drive local, I'm home every single day, but that doesn't matter. I could still come in contact with somebody who's asymptomatic. I knock on wood every day. And every week and hour that goes by and time that goes by over these almost 2 years. I don't know what people do every day. I don't know where they're getting infected. Government never says that. But I'll say this. Do you know who's doing contact tracing? And not just because they've been ordered to do it. Bars and restaurants. And they were doing that even before they were asked to do that. Take your name, your telephone number. And even that we're fully vaccinated, and only fully vaccinated people are allowed to go into bars and restaurants and movie theaters and gyms and concerts and sporting events. Even at the sporting events, they don't have time to have 20,000 people wait outside and come in at one time and give your name and telephone number. I mean, they couldn't even come up with a scanning system, and where a bar and restaurant could come up with a scanner to scan your QR code. And they couldn't even do that at a huge sporting event like a hockey game. It would speed up the process of getting people in. You know, they're fully vaccinated. But contact tracing is what these bars and restaurants have always done. But then who gets shut out of everything when we have to go into lockdowns? Bars and restaurants and non-essential businesses. Those are the ones who are doing the contact tracing. But then yet they have to suffer. And you know, with the big box stores, you know, before the government finally said, okay, you know, the big box stores have to block off all their non-essential items. Because if a non-essential business couldn't sell their stuff, then why should they have been able to do it? And even the big box stores wasn't even doing any contact tracing when people were going in there shopping. So where are people getting infected? We don't know. Yeah, we have 3,300 cases a day at this very moment, but where were you? The government will do their sort of contact tracing of asking you questions and retrace your steps. They're going to tell the general public of where these people got infected. I don't know. Did you go to a big party with unvaccinated people? I don't know. Or are you just simply careless? I don't know. Being outside is a good place to be. See, shopping malls have been full for probably, since October, because people, going Christmas shopping in October, November, and December, so no capacity limits, people unvaccinated, allowed to go shopping. Touching everything. Just not allowed to go to bars, restaurants, movie theaters, gyms, sporting events. Only the vaccinated people. But where have they been? I don't know, ladies and gentlemen. I don't know where people are getting infected. I don't know. Because if we knew, then we would stay away from those places. Right? It has to come from somewhere. It has to come from outside to the inside. This is why we have, even right here in the city of London, Ontario, Canada, where I reside, again with the university students living on campus, have an outbreak. Our public schools and high schools have outbreaks. Now they're on Christmas holiday. Where did it come from? I don't know. And that's why they're talking about, even back, when the Christmas break is finished, and even the university here in the city and the college here in the city are going to go online starting in January. They've already talked about extending the Christmas break for the kids an additional 2 weeks, which that could be extended another additional 2 weeks, could bring you right to the end of January, where they'll be doing online learning if these case counts don't come down. And that's going to put a lot of hardship on a lot of families because, people have to go to work. All the single parents out there, the single moms out there, they have to go to work, but yet, the kid's going to be at home. Who's going to watch the kids? Mom is going to watch the kids. I don't know what to do anymore. I really don't. With the Premier of Ontario, I think it was like Wednesday. Yeah, it was like Wednesday, because this is when, these announcements start to come out, so Wednesday, Thursday, Friday. And then I wanted to talk about these things because I wanted to make sure, okay, was Friday the very last day that the government was going to make these announcements? Is anything going to change on Saturday? Because the Premier could come out any single time and say, oh, we have to make some changes. So I wanted to make sure. That, okay, Saturday passes. Okay, this is Sunday. This is when these new restrictions take place. Reducing capacity in indoor settings to 50%. Last year, ladies and gentlemen, the government waited until the day after Christmas to go back into lockdown and stay-at-home orders. It could happen again. But last year it was limited just to the single-family households. Nobody else. Couldn't have your friends over for Christmas Eve It was immediate family in that household. And even over our Thanksgiving back in October, families across this country weren't holding Thanksgiving because they had family members who were not vaccinated. And the same thing is going to happen this Christmas. They're simply not going to have it because a certain family member is not vaccinated. Now, that's taking it pretty seriously when you got to cancel Christmas, right? It's a pretty sad state of affairs, because, families around the world, they all have anti-vaxxers in their families. And then the family has to cancel Christmas because of your sorry ass? Because you don't want to get vaccinated? It's just like Thanksgiving. Same damn thing. Common sense. Ladies and gentlemen, common sense. Has to prevail. But I want to thank you for taking the time out of your busy day, whether it's morning, afternoon, nighttime, wherever you're listening around the world live here on the Truckers Podcast. I want to thank you for coming out and joining me this morning to kind of, just give you what is happening here in Canada, here in the province of Ontario. Every province is different. Every province has its own problems with this virus. And like I say, things are changing rapidly every single day. If you have Christmas shopping still to do, get it done. I'm done. I've been done for a while. I just wanted to get it done. I didn't want to be out there that last minute. I didn't want to be out in that hustle and bustle. And now with sorry I'm going on here, but when it comes to 50% capacity in shopping malls and the grocery store, we're going to be lining up again, waiting to get inside. I don't know. Get your Christmas shopping done. But again, thank you, ladies and gentlemen, for coming out here on the Truckers Podcast. Thank you, ladies and gentlemen. This is the Truckers Podcast. I'm your host, Doug, from Ontario, Canada. Take care. Be safe.